Attention all anatomy aficionados. This is the anatomy of a gallbladder. To begin with, the main functions of the gallbladder are to store and concentrate bile, also called gall, needed for the digestion of fats in food, produced by the liver. Bile flows through small vessels into the larger hepatic ducts and ultimately through the cystic duct, parts of the biliary tree, into the gallbladder, where it is stored. At any one time, 30 to 60 milliliters or 1.0 to 2.0 US fluid Oz of bile is stored within the gallbladder. When food containing fat enters the digestive tract, it stimulates the secretion of cholecystokinin or CCK from eye cells of the duodenum and jejunum. In response to cholecystokinin, the gallbladder rhythmically contracts and releases its contents into the common bile duct, eventually draining into the duodenum. The bile emulsifies fats in partly digested food, thereby assisting their absorption. Bile consists primarily of water and bile salts, and also acts as a means of eliminating bilirubin, a product of hemoglobin metabolism, from the body. The bile that is secreted by the liver and stored in the gallbladder is not the same as the bile that is secreted by the gallbladder. During gallbladder storage of bile, it is concentrated 3 to 10-fold by removal of some water and electrolytes. This is through the active transport of sodium and chloride ions across the epithelium of the gallbladder, which creates an osmotic pressure that also causes water and other electrolytes to be reabsorbed. Also, a function of the gallbladder appears to be protection against carcinogenesis, as indicated by observations that removal of the gallbladder or cholecystectomy increases subsequent cancer risk. For instance, a systematic review and meta-analysis of 18 studies concluded that cholecystectomy has a harmful effect on the risk of right-sided colon cancer. Another recent study reported a significantly increased total cancer risk, including increased risk of several different types of cancer, after cholecystectomy. Gallstones form when the bile is saturated, usually with either cholesterol or bilirubin. Most gallstones do not cause symptoms, with stones either remaining in the gallbladder or passed along the biliary system. When symptoms occur, severe colicky pain in the upper right part of the abdomen is often felt. If the stone blocks the gallbladder, inflammation known as cholecystitis may result. If the stone lodges in the biliary system, jaundice may occur. If the stone blocks the pancreatic duct, pancreatitis may occur. Gallstones are diagnosed using ultrasound. When a symptomatic gallstone occurs, it is often managed by waiting for it to be passed naturally. Given the likelihood of recurrent gallstones, surgery to remove the gallbladder is often considered. Some medication, such as ursodeoxycholic acid, may be used. Lithotripsy, a non-invasive mechanical procedure used to break down the stones, may also be used. Known as cholecystitis. Inflammation of the gallbladder is commonly caused by obstruction of the duct with gallstones, which is known as cholelithiasis. Blocked bile accumulates, and pressure on the gallbladder wall may lead to the release of substances that cause inflammation, such as phospholipase. There is also the risk of bacterial infection. An inflamed gallbladder is likely to cause sharp and localized pain, fever, and tenderness in the upper, right corner of the abdomen, and may have a positive Murphy's sign. Cholecystitis is often managed with rest and antibiotics, particularly cephalosporins and, in severe cases, metronidazole. Additionally, the gallbladder may need to be removed surgically if inflammation has progressed far enough. A cholecystectomy is a procedure in which the gallbladder is removed. It may be removed because of recurrent gallstones and is considered an elective procedure. A cholecystectomy may be an open procedure, or a laparoscopic one. In the surgery, the gallbladder is removed from the neck to the fundus, and so bile will drain directly from the liver into the biliary tree. About 30% of patients may experience some degree of indigestion following the procedure, although severe complications are much rarer. About 10% of surgeries lead to a chronic condition of post-cholecystectomy syndrome. That's all for now. Thanks for listening. Please comment and subscribe for more content. Goodbye.